The vagina is a self-cleaning organ. Now, you might have heard this before. What do I mean by this? I mean, you don't need to wash your vagina. It cleans itself. That means no douching. I have a video on the importance of not douching. Douching can actually be potentially harmful. I'll link that video here. But the idea, guys, is your vagina self cleans. Now, let me remind you of some anatomy because I know some of y'all are going to be like, what you mean? What do you mean not clean my vagina? I definitely clean my vagina. Okay, let's do some anatomy just to make sure we're all on the same page. The vagina is sort of the birth canal where the baby comes out. The vagina is the tube that leads up to the cervix. The canal, that's the vagina internally. And you can understand how that is self-cleaning. You don't need to put anything up in there. That is different from the vulva. The vulva is the external genitalia, what you can see when you look down there. The lips, the labia, the clitoris, things like that, okay? That's the vulva area, sort of in general. That, yes, you can wash, and I advise it, okay? You're wondering, how do I wash it? Well, gentle soap is the best way to go. Don't scrub too hard. Don't use really harsh soaps or soaps with a lot of perfumes or deodorants or things like that because it could cause some irritation. But yeah, you can wash that external genitalia, the vulva area, with gentle soap. I would also say be careful with bubble baths and certain like laundry detergents and stuff like that. That can actually be irritating as well too. Guys, I'm Dr. Jen Caudle, practicing family physician. We are talking about how to keep your vagina healthy. By the way, for those of you watching this video, if you're wondering if I did the same for people with penises, I did. I have a video on how to keep your penis healthy, just as an FYI. I'm an equal opportunist here. Okay, other ways to keep your vagina healthy. Let's talk about sex. Okay, let's talk about sex, baby. All right, you know what I'm talking about. You want to make sure that you're using safe sex. Okay, safe sex is so important. We're talking about barrier methods. This is very important. Condoms is what helps prevent and protect against things like HIV, chlamydia, gonorrhea, etc. And you may be wondering, well, how is that going to keep my vagina healthy? Remember that many STDs can literally affect the health of your vagina as well as other parts of your body. So literally, making sure that you're using safe sex practices is going to be very, very important. Third, let's talk about our menstruation. You know, as people with vaginas, we often menstruate, right? It's going to be really important to pay attention to the instructions on your tampons and your pads. What am I getting at here? I'm getting at, don't wear your tampons longer than you should. We're worried about things like toxic shock syndrome and other conditions. Make sure you're following those instructions. Be very careful because things like toxic shock syndrome can and do actually happen, okay? The next one is make sure that you are getting your screenings. That is pap smears. If you wondered what the pap smear is for, it's to screen for cervical cancer. So we have many different screening tests to screen for different cancers. Think about the mammogram that screens for breast cancer, colonoscopy screens for colon cancer. By the way, you should be getting all of those when it is time for you based on your age and underlying medical conditions. But the pap smear, okay? And guidelines do change in terms of how frequently you need to get them. So get guidance from your GYN or whichever doctor, maybe it's your family doctor. For years I did pap smears. Whomever is doing your well woman care to find out when you need to come back in next. That's important because that helps screen against cervical cancer. That is part of keeping our vagina healthy. And also, I should say, that while we are doing pap smears, while we are down in that area, it's also a good chance to look around and not only look for cervical cancer, test for it, but to test for STDs, to look at your skin around the vagina, the labia, etc., to make sure everything's okay. Very important there, all right? Next thing is to get vaccinated. Now, you're probably saying, what does vaccines have to do with my vagina? Well, there is one vaccine I'm thinking about in particular. That is the HPV vaccine. It stands for human papillomavirus. I have a video on that, by the way. This is a virus that tends to be sexually transmitted, but the thing about it is, by the way, men and women can have it. By the way, it can cause certain types of cervical cancer, but it can also cause genital warts and other types of cancers as well. Really important. Actually, this is very important for men and women. This vaccine is eligible for men and women depending on your age. So keep that in mind. Okay, let's talk about what we wear. All right. What you don't want to wear is you don't want to be staying in your like sweaty gym clothes for hours and hours and hours running errands after you've gone to the gym. Okay. You want to make sure that any wet or damp clothes you're getting out of. Okay. Because wetness, dampness can create an environment where bacteria can grow, potentially predispose you to infections. We do not want that. You go to the gym, you get all sweaty, etc. Make sure you're taking those clothes off. Speaking of clothing, also, in terms of the underwear that we wear, truth of the matter is good old fashioned cotton tends to be really, really ideal for making sure our vagina stays healthy. Why? Because cotton sort of allows air movement, allows our vagina to breathe. Again, may reduce the risk of getting infections down there, where other fabrics sometimes trap in moisture and heat and may be sort of a breeding ground. We don't want that. Okay, next thing, pay attention to your symptoms. Okay, symptoms down there. What am I talking about? Let me give you some examples. If you are postmenopausal, if you are in menopause, if you have stopped getting your periods, and all of a sudden you start getting vaginal bleeding, almost like a period or something a little different, but bleeding from your vagina again, that is a run to the doctor ASAP type of situation. Okay, you should not bleed after you've gone through menopause. If you do, from the vagina we're talking about, you got to see your doctor ASAP. So that's what I mean. That's an example of what I mean by paying attention to your symptoms. Other things, rashes down there, itchiness, dryness, lumps or bumps. By the way, if you feel like you have some lumps or bumps, could you please get a mirror? And I have this in some of my other videos. I have a video just on lumps or bumps, by the way. But get your mirror and stick it down there and take a look and see what you can see. It's going to be important for you to know what's there, okay? It also will allow you to describe better to your doctor what's going on. The other thing is sometimes what we feel or what we think is down there actually is not much of a big deal, and you might come to that conclusion yourself if you actually look. So just make sure you are aware of your vagina, what's going on down there. Also, other things, I have a video on vaginal dryness, which is something that can happen in particular during the menopause years. It can be really tough to have vaginal dryness. It can be tough for sex and for comfort and all sorts of other things. This is a part of paying attention to our bodies. If you notice vaginal dryness, any of the things I mentioned or more, talk to your doctor because there are often solutions, ways that we can help you and fix whatever is going on, okay? The next thing is to get tested. We talked about having safe sex, very important to use condoms. But the other part of that is making sure that you get tested and have this conversation with your partner. Okay. I really truly believe in my heart that if we're at the place that we're talking about having sex with our partner, we should also be at the place where we're able to talk about getting tested. And that's going to help protect you as well as your partner. Get tested. And the last thing I would say is to make sure that you are treating your whole body well, because treating your whole body well will also help your vagina. I mean, eating healthy, exercising, making sure you're taking care of your heart and so many other aspects of your body. If you have diabetes, keeping that in control. Remember, uncontrolled diabetes can be a risk factor for certain infections, even yeast infections and other things. By the way, so you want to make sure that you're looking at your whole body holistically, even as we think and talk about keeping our vaginas healthy. That's very important. But remember, in the end, you know your body best. If there is something going on that you don't know what it is and it seems concerning, or even if it doesn't seem concerning, make sure you talk to your doctor about it so we can help you along. These are just a few points to help you on the path of keeping your vagina healthy. Guys, let me know what you do to keep your vagina healthy or what you've been taught to do by your doctors. Let me know right in the comments, because sometimes what you write helps other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you have not liked and followed my page on Facebook, by the way, if you're not on Facebook with me, come on over. Please like and follow my page. For those of you who send stars over there, thank you so much in advance. On YouTube, hello YouTubers, please subscribe to my channel. Click the little bell for updates. I do daily health videos. Also, go to my website, drjencaudle.com. You can sign up for my free health newsletter. And I have subscription groups on all my social media. And I'm also on WhatsApp and Instagram and TikTok and you name it. Anyway, guys, I'm Dr. Jen. I'll see you soon. Love y'all. Bye.